Hi, I'm Dr. Isaac Wornom here at Richmond Plastic Surgeons, and I'm here with my patient Molly. Molly's been my patient since 2018, I think. She came to see me for some wrinkles in her face that she wanted to have treated to keep herself looking younger. And she has been a very regular patient for Botox and filler for the past 5 years. And I think it's one reason she's so pretty, is she comes regularly. The last time we gave her Botox was, I think, about 5 months ago. And the places we usually treat, Molly, could you wrinkle your eyebrows? So we usually treat this spot right here. You can see how she develops these dynamic wrinkles. This is from the corrugator and procerus muscles. Botox is a muscle paralysis agent, and you inject it into these muscles and it makes them not move, and it makes those wrinkles not form, and it has a secondary effect by paralyzing those muscles of raising your eyebrows a little bit, because those are the muscles that pull your eyebrows down. And many of my patients like that effect as well, that it's almost like a little brow lift to lift the muscles up. Another place we treat, raise your eyebrows, Molly. You see how she develops those muscles across her forehead? So I'm going to target the frontalis muscle, which is the elevator of the eyebrows. I'm not going to over-treat that because I don't want the eyebrows to fall, but I want to give her just enough that she won't develop those wrinkles in her forehead. And finally, smile real big. She's got these little fine wrinkles around her eyes there. When she smiles, those are called crow's feet. You don't see them when her face is in repose. So by paralyzing that little muscle around the eye there, she will not form those crow's feet, and it also will help wrinkles in her lower eyelid from forming by diminishing the action there. The final thing we're going to treat today, and the last time I gave her filler was over a year ago, tends to last about a year for her, is we're going to put a hyaluronic acid dermal filler into this line right here and this line right here to smooth it some. And that works different than Botox. It just kind of plumps it up a little bit and makes that transition from the cheek to the lip smoother. And the final thing I'm going to do with the filler is put a little bit here and here. And what that will do is lift the corner of her mouth just a little bit, which will change her resting mouth position and make her mouth look a little more upturning. So that's our goal today with those treatments. You can also use filler to make the lips larger. You can use filler in people that have lost volume in this part of their face in the office to plump up the cheeks and restore that. Molly does not need that. One thing I'll say about Botox and filler here at Richmond Plastic Surgeons, there's a lot of places you can go get Botox and filler by nurse practitioners, by nurse injectors. Some of them do an excellent job. But if you come here to Richmond Plastic Surgeons to get your Botox and filler, you're going to have one of the physicians do it, one of the board-certified plastic surgeons. And all 6 of us have done this a lot. So, okay, you ready to go?
I'm ready.
So this is a medium density hyaluronic acid filler. I'm going to first inject it into Molly's nasolabial folds to try to smooth this transition from the cheek into her lip. I start at the top. I want to inject it into the deep dermis, and you'll see this gradually raise up and diminish her depression there. I kind of slowly work my way down the nasolabial fold, injecting a little bit as I go. I can always add more, and you can see it correcting it nicely. That's a total of 0.3 cc's, and you can see how that's changed that some. I'm going to go to the other side. Now we're going to treat the left nasolabial fold, and just like the right, I'm going to start at the top, inject it into the deep dermis, sort of slowly work my way down here, filling this fold, Going to put about the same amount in, about 0.3 cc's. I am not into overfilling people. I don't like overdone filler. I like it done just right. I think you can over-treat people with this and make their face look baggy. I don't like that look. Now we're going to go to the nasolabial fold here, and I'm going to change the corner of Molly's mouth just a little bit with a shot right in here. You can see how it's pushing that up. The filler's just lifting the corner a little bit. Looks good. I'm going to go to the other side.
Ready.
Now we're going to treat the right oral commissure. Try to lift this corner a little bit, just like the other side. You can see this filler pushing that corner up just a little bit to change the corner of her mouth. That's good, Molly. Now we're going to put some ice on it. Here you go. Now I'm going to treat her with the Botox. So we're going to treat the corrugator procerus, these 11 wrinkles first. This tends to elevate the eyebrows a little bit. This doesn't hurt very much, but it hurts a little bit. Yeah. Okay, that's good. Now I'm going to treat Molly's crow's feet. Smile real big. You ready?
Yep.
The target muscle with this shot is the orbicularis oculi muscle, which is right under the skin there. Smile real big, Molly. Relax. Okay. Now we're going to treat the left orbicularis oculi to make the crow's feet less noticeable. Raise your eyebrows for me. Thanks. Now we're going to treat her frontalis muscle, which will help with these forehead wrinkles. This material paralyzes that muscle. I'm injecting just a little bit in the muscle across. All done.
Yay.
You did great.
Super simple.
So that's a Juvederm and Botox treatment.